Hey guys, welcome back. This is exciting. We are in another moment of chaos and crisis, and we get to work with Edye Edens, who's going to educate us on all things research. The one thing we're talking about right now is NIH funding and how it's being cut and how how our agencies and all of us dealing with it. Edye, you want to add a little bit of a finer point to that?
Yeah, well, as well as the workforce. I mean, we're seeing federal workforce across, the gamut. But obviously, in our ecosystem, we're thinking about cuts to the FDA, cuts to other government agencies, Office for Human Research Protections, Office of Research Integrity, multitude of DHHS agencies that help support and stand up research. And I want to frame this in the mindset of what is the immediate impact? Obviously, we're all concerned about patients. We're all concerned about innovation. But if we can take just ever so slightly a step back from that for a moment and at a more global level say, does this impact turnaround timelines, approval timelines,
Ye-
innovation, right? Like, how is this immediately going to change? Even if, let's just give some benefit of the doubt, we'll extend it. Let's say that this does, in the end, have a positive impact on, say, waste or the national debt. Maybe there is efficiency to be gained on the other side of this change, but what kind of pain and how long is that pain going to exist? And will we have any type of negative impacts that then so overshadow the cut of the waste because now we can't get a drug approved, in half the time we could before?
The Trump administration is looking at a business that's going to show short-term quarterly results, which is great.
Right.
The downside of that is, how do you see the 15-year down impact? And I'm
Yep.
not sure we're seeing that in the same way right now. And maybe we are, and maybe we're all going to be looking at this in 15 years and going, yeah, you know what? We were wrong.
I've wondered if part of the administration's strategy here, like to us on the outside, it looks like, oh my gosh, you're cutting NIH funding on Friday and you expect that to go into force on Monday. We don't ever have something happen that quickly in our industry. We have notice periods and planning and strategic. Now, as someone who loves efficiency, I'd love to see us not take years to implement regulation and make changes.
Yeah,
I think we all agree on that. So I'm not
yeah,
against the idea of speeding it up. You know that there has at least been some economic and financial success by Elon Musk and by Donald Trump in their own private business dealings. No
absolutely.
questions asked there. I have to imagine they have some amount of strategy and advisors and leadership who would also say, hey, 48 hours, there's no way this can happen, right? You're bull in a china cabinet. But was that on purpose? Was it, hey, we're going to go to an extreme and say something we know you will all absolutely hit the ceiling about because that's our first kind of shot across the bow, and then we're going to make you fight us back. And then that compromise ends up being, well, we never agreed to the 15% blanket because it got challenged in the courts, but now we've agreed nobody can go above, say, 50.
I have two responses to that. I think Elon Musk bought Twitter and then cut off, I think it was like 80% of his workforce
Hmm.
within days with very, very little notice. So
Yep.
he thinks that because he was able to do that, he's able to effectuate this at a federal
Right.
government level. And I'm not completely convinced that that's an easy one-to-one comparison. I
Yeah.
think the other part of this is they're looking to lay people off. They're looking for reasons to lay people off. And if you can say, I told you everything needs to be cut off within 2 days, and you still didn't make that cutoff, that you're about to be fired.
I'm very concerned for, like I said, the short term without having any type of a transition plan or allowing agencies or AMCs to have one. You're running the risk of having to just shutter open trials. You're running the risk of having to make some very quick and not well thought out decisions on all and everyone's part. And did we expect cuts at the NIH funding level across the board? Of course, every administration fights over this. To be clear, this is not just a Republican or a Trump administration issue. Every single administration that comes in has a different take. We see this change every 4 years if the administration changes over on some level. This is just an extraordinary change in a very short amount of time and without a lot of public conversation as to the why and to the what will happen
I think
next.
number one, the fact is that while this sounds great at a productivity level, which is
Right.
great, what we're not thinking about is the FDA, even more so I'd argue than the EMA, is probably the world's premier regulatory agency. Like, you are seeing the EMA does not defer to the FDA, but it respects the FDA's
Yep.
opinion quite a bit. There are regulatory agencies in this world that will go, we don't even need to do the approval. FDA said, okay,
Because the FDA
we're
did.
good with it. Exactly.
Yep.
Where do we land up if the FDA is cut? I saw a stat article, 50% of their people get cut off. No one can work at the same
At
efficiency,
50%.
even at Twitter.
Well, and you're seeing where they're saying outright, for every 4 people that go, you're only allowed to hire 1 back if you're allowed to hire at all. So, I mean, it's not as if we're saying this is a temporary cut, we're going to evaluate and rebuild. This is a cut. And I wonder if we fully understand what a 50% workforce cut at the FDA or this drastic funding cut at NIH means, because I don't see how that aligns with America first. And here's the thing: everyone needs healthcare. Everyone is going to need healthcare at some point in their lives. A state like Texas, which is not one of the states that's suing the government, is obviously a state that overwhelmingly is Republican and supports the Trump administration, has been very loud about that. It's also a state that stands to lose $300 billion a year in NIH funding from this specific change by the organization.
AI just had its quote unquote AI moment where OpenAI got leapfrogged by DeepSeek. And what DeepSeek did was they basically did what OpenAI does, just cheaper, faster, stronger. And the argument was, when will biotech have its moment like that? When will pharma have its moment like that? The truth is, it's already happening. China's already doing better versions of drugs that have been approved previously. The fact is that came out because of the innovation happening in the US.
If we restrict the funding on those same organizations, those APIs go right back to China, which again, I don't believe aligns with this administration. I don't believe that is what they want to happen. I don't actually believe the average consumer in the United States, no matter how they voted, wants that to happen. And so again, I feel like this is a time of, it's tumultuous and it's chaotic, but it's also a time to educate. It's a time to speak out and learn and know, because I don't know that everyone who's in a decision-making capacity fully understands that. And to be fair, I don't expect them to. I mean, you and I do nothing but this all day. We know there's 100 attorneys in the United States who do what we do, if that. I mean, this is a nuanced area. This is unique. But what I'd really love to see is individuals from these different stakeholder groups at least have a little more representation in these decisions, at least have a little bit more conversation. I know we want to move quickly and we don't get caught up in bureaucracy, and I actually respect that.
I agree 100%. And we're going to have to keep having these conversations, because
oh my gosh, so many. We can have like 8 a day. Thank you so much.
Thank you again, Edye. Call, click, or email.